one of the ways that I want to kind of talk about this is the triage model. And this is how we got to start rewiring how we actually think about some of our audits and our role within those audits. And the entire goal here is to stop the bleeding. And again, to make sure that we're all on the same page, uh, I want to give a medical analogy to this. And please feel free to use this if you want to help try to explain this shift to your stakeholders or discuss it internally with your team about, hey, maybe this is something that we want to do going forward. So think about the difference between preventative care and emergency care. I'm sure everyone here, either yourself or have had a loved one that has been to the doctor, you get your annual physical, or there was some type of emergency, you had to go to the emergency room to be taken care of. And this is where I want us to think about it. So your annual audit plan, and hopefully you're updating it a little more than annually, that's your preventative care. And it provides the audit committee and management with the comprehensive annual physicals and the blood work that's needed to evaluate the overall baseline health of the business. And again, that's absolutely necessary. But it's not necessarily designed for those medical emergencies. So imagine an ER. If a patient comes in with a severe wound, and anyone that's seen the TV show like The Pit, you're not going to ask them to fill out a 40-page medical history form and check their cholesterol. Your focus is very simple. It's to stop the bleeding and stabilize the patient. The micro audit makes us part of kind of that diagnostic first responders. Again, it's highly targeted. It's a high velocity triage engagement. So your strike team goes in, you perform that kind of diagnostic MRI to help isolate the anomaly, working with the medical professionals. And it may come out that, hey, we recommend a tourniquet via a specific action plan. And then we get out of the way so that, the medical professionals can go in. They apply the tourniquet. But we're making sure that, hey, after you do the tourniquet, and make sure that you have the allocation and the approval to get that surgery done and that the patient's going to get the proper PT and so forth afterward.